Hey, what's up? Yes, like I said, let's do the part two of the nursing prioritization question and answer for the NCLEX. You will have to watch the part one in order to understand this part two. This is a continuation, okay? Whenever you come across this recording, try to watch the part one. It's a continuation. And if you watch the part one, you have to continue to watch the part two. So, having said what we said in part one, we went through prioritization and we saw some guidelines in prioritization. We saw some four rules of prioritization and we saw some examples. Let's answer our second question here. The question says, the nurse finds a suicidal client trying to hang oneself with a belt. Which nursing action is priority? So, can you recall the rules we follow? We discuss the guide. You can use ABC, you can use Maslow hierarchy, you can use nursing process. So, secondly, you look here, you see that it will be applicable to use Maslow's hierarchy of needs here. Let's see the option first. Place the client in a seclusion with intermittent checks. B, assign a nursing staff member to remain with the client. C, make the client always stay with the group. D, refuse to let the client back into his room. Yes, we have to apply Maslow hierarchy of needs here. First, you check, uh, is he talking about does the patient need some physiological, some physical needs? No, the second one is safety. So here, the next need is safety. And what we have to do, the answer is B, assign a nursing staff. So when we have conditions like this in suicidal condition, the priority here is one-on-one staff to client, right? This is very important. This allows the client to remain, have self-esteem and keeps the client safe. A, you cannot do seclusion. Seclusion is like uh, isolating the client and keeping the client alone. This will aggravate the situation and makes the client more suicidal. It will damage the self-esteem of the client and does not provide any adequate monitoring. The client is there alone in the room. This is a client who has suicide thoughts, right? C and D does not guarantee any safety. So that's how you look at it. Let's look at the next question. Um, the nurse employed in an emergency department is assigned to triage clients coming to the emergency department for the treatment on the evening shift. The nurse should assign priority to which client, right? So when you're doing prioritization question, there's a way that you attend to client and the ED. There's what we call triage. You sort out according to the severity of the condition. A says a client complaining of muscle aches, headache, and history of seizure, right? This is a client who twisted her ankle when roller blading and is requesting medication for pain. C says a client with a minor laceration on the index finger sustained while cutting an eggplant. D says a client with chest pain who states that he just ate pizza that was made with a very spicy sauce. Now I think these are four different clients. What do we say? Apply the rule of stable and unstable, right? And in this question, I will help you to revise something. We have a priority. We in the emergency, we assign colors to triage levels, level 1, level 2, level 3, level 4, and level 5. And each level has certain types of conditions that you must pay priority to. We're going to see that. The answer here would be D. Whenever you see a condition of chest pain, it takes priority And in the ED and in any condition, any chest pain is considered a myocardial infarction unless otherwise ruled out. Know it from today. The chest pain is classified priority number one, and it's always a myocardial infarction, otherwise ruled out. The answer is D. Now, let's use this question to revise what I was saying. This is what I was saying, okay? Priority number one, the red zone, red color, okay, is called the immediate, the emergent you have to attend to immediately. These are life-threatening conditions, chest pain, trauma, severe respiratory distress, cardiac arrest, limb amputation, these conditions that I've listed here. The second level is yellow, called priority 2. You can delay a bit, okay? It's called urgent, right? It's called urgent. And what are these conditions? Simple fractures, asthma without respiratory condition, okay? So the patient is asthmatic, but the patient is not presenting with asthma exacerbation, okay? If the patient that we can delay to attend to. When you read a question, pay attention. But if the patient is asthmatic and is on asthmatic exacerbation, that is a respiratory distress, it goes up to red zone, priority number one. You attend to this patient first. Okay? Fever is never an emergent problem. Okay? It's an urgent problem, but not an emergent problem. Okay? Hypertension, abdominal pain, we classify them here. Renal stones, We move to the green zone, priority 3. It's called minimal. Okay? Non-urgent, right? Minor lacerations, minor burns, fractures, bleeding, sprain, core symptoms, we classify them here. But the other priority, the other level, which you have to be careful when it comes to disaster conditions, is the last level. We call it no priority level. The color coded there is black. These conditions, they are considered either they are disease, they are death, or they are in conditions that cannot be resuscitated. Conditions that you determine that they cannot be revived. You attend to them last, especially in disaster conditions. These conditions, these clients will not be a priority. Okay, will not be a priority. Be careful. Be careful. Hope you learned something. Get a pen and paper and take down notes. Let's move to the next question. The nurse is assigned to care for 4 clients. Okay. In planning client rounds, which clients should the nurse assess first? These are 4 clients. Remember our rules. A, post-operative client preparing for discharge with a new medication. B, a client requiring daily dressing changes of a recent surgical incision. Okay. C, a client scheduled for a chest x-ray after insertion of a nasogastric tube. D, a client with asthma who requested a breathing treatment during the previous shift. 4 clients, 4 conditions, 4 different conditions. We apply stable and unstable here. Okay. And we start eliminating. Let's do the elimination rule here. A, post-operative client preparing for discharge. A discharge client is a stable client. That is out. A client requiring daily dressing changes of a recent surgical incision. Just dressing, the patient needs dressing. There's nothing much here. It's a recent surgical incision, yes. It's not a post-op condition less than 12 hours. We eliminate. A client scheduled for a chest x-ray after insertion of nasogastric tube. Yes, a chest x-ray. We have to, let's keep it and we move next. You say after insertion of a nasogastric tube. You know, when we insert, we have to check for the placement, right? But you have another client here, asthmatic diagnosis, modifying phrase, requested a breathing treatment during the previous shift, right? It means this patient should have been feeling difficulties of breathing and, this is change of shift. And the nurse tells you, oh, patient in whom this requested breathing treatment, sorry, I did not give. This should be the patient you go and attend to first. Airway, breathing is very, very important. Always a priority. Airway is always a priority, right? It's always a priority. That's how you go by elimination and you get to know which option you have to choose. So always make sure that you attend to the client with asthma who requested breathing treatment during the previous shift. Other conditions, the other patients, they are intermediate priorities. They are not urgent priorities, emergent priorities. Let's look at the next question, right? Let's look at this. I hope we learn something. Yeah. Number 5, the office nurse received 4 telephone messages. Which client should the nurse call back first? You've come across questions like this, right? Even you working, you face conditions like this. A 28-year-old female client who fell on ice yesterday and has low back pain and spasm. B 42-year-old male client who developed sharp burning leg pain radiating from buttock to knee after lifting heavy weights. Okay. C 65-year-old female client 10 days post-spinal fusion who has increased persistent back pain and fever of 101.2. Okay. D 70-year-old male client with peripheral vascular disease who has acute onset of abdominal pain radiating to the lower back. 4 rules of prioritization: acute versus chronic, right? Post-op less than 12 hours versus post-op above 12 hours. Stable and unstable. Let's eliminate age and gender. We have no concern about that. No concern. We look at first rule, which one is acute? D, we say 70-year-old male with peripheral vascular disease who has acute onset abdominal pain. This is a new change of condition. You have to attend to this client first. This client is indicating abdominal aortic aneurysm. This client has peripheral vascular disease. It's a sign of abdominal aortic aneurysm, which is very, very devastating. And this could be a rupture. It could be a rupture, right? So you have to attend to this client first. The client might be bleeding, okay? You look at signs of shock, decreased blood pressure, systolic blood pressure, weak pulse, pallor. This is a priority. The pain in the ear is a muscular condition, right? Musculoskeletal condition. It's not life-threatening, right? B, it could be some irritation of the sciatic nerve. You have to evaluate. But there is a patient who is having a life-threatening condition. You have to attend first. Right? Perfect. See, the pain could be fever from a post-op, right? Post-op infection. What do? You have to diagnose this patient and you treat, but there is somebody with a life-threatening condition you have to attend to first. Let's look at the last question for the day. Question number 6 says, which client in the ED should the nurse see first? Yes. A, 2-year-old with fever and sore throat who is restless and drooling. B, 7-year-old with appendicitis who has right lower quadrant pain and vomiting. C, 9-year-old with immune thrombocytopenia who has generalized petechia. D, 17-year-old with cystic fibrosis who is coughing up thick blood thin sputum. Which one should we see first? In this case, you have to apply your knowledge of pathophysiology. You have to know your medical conditions and signs and symptoms. When you see the clinical manifestations, you should be able to determine that these signs are indicative of this condition. A is the right answer. Sore throat, who is restless and drooling. This is a condition of acute epiglottitis. Okay? This client has airway compromise. The airway is obstructed. It is a medical emergency. You have to attend to this client first. This client is presenting with restlessness, stridor, drooling due to dysphagia. Okay? Prepare this client for emergent endotracheal intubation. This is what you have to do. In B, okay, if left untreated, it may rupture and cause peritonitis. It is emergency situation. Yes, we accept, but airway first. A client with obstructive airway should be seen first. A, B, C. Right? C, okay. This could be signs of, of course, they said it's immune thrombocytopenia. This is acute condition. Sometimes this condition resolves spontaneously without complications, okay? Yeah, petechia, these are signs of ITP. D, cystic fibrosis, coughing up thick blood thin sputum. Evaluate the patient and treat. It's not a priority. Okay. I hope this helped you. Please subscribe, share our videos, and comment, like, and let us know if you enjoy the way I do the presentation. See you in my next video.